How do our bodies process sugar, or C12H22O11? Let's start with the normal sugar management of a bag of Maynard's Swedish berries. Starting by opening the bag and chewing on the sweet taste of artificial sweeteners and blah blah blah, one thing leads to the next. The important thing to know here is that there is an increase in the amount of sugar in your blood. Beta cells in the islets of Langerhans in the pancreas will produce more insulin and secrete it into the bloodstream. Insulin is a hormone that helps glucose in the blood go into cells and thus reduces blood sugar concentration. Another important hormone to mention at this point is glucagon. Glucagon is basically the opposite of insulin and wants to keep our blood sugar at a level for us to keep functioning. For example, if I didn't eat that bag of Maynard's Swedish berries, my pancreas would instead release glucagon from the alpha cells. Glucagon will cause the liver to break down glycogen and secrete it as glucose into the blood. In addition, glucagon will start gluconeogenesis, and if I'm really desperate for some sugar, it will start to break down my fats as well. Now, an important thing to remember is that the way our body manages our sugar is through a negative feedback loop. This is the process of reducing the changes in our body through small changes in the secretion of insulin or glucagon. As you can see in this graph, when I eat a bag of Maynard's Swedish berries, my blood sugar will go up, causing insulin to be secreted and bring it back down. But can't go too far, so glucagon kicks in and brings it back, while the production of insulin is reduced. This essentially continues on until you die, or if you have diabetes, it gets out of hand. And great, now we are finally getting to what this video is supposed to be about: diabetes. There are two types of diabetes, type 1 and type 2. Basically, in type 1, the immune system attacks the beta cells that produce insulin. This means bye-bye insulin and hello high blood sugar. Of course, classic symptoms of a patient suffering from type 1 diabetes will include a high blood sugar reading after fasting, sweet smells from the urine and breath, glucose molecules found in the urine, and increased thirst and urination. Remember that glucose is free-flowing and normally reabsorbed 100% in the proximal tube of the kidney. When glucose appears in the urine, it is because the mechanisms for transporting the glucose out of the proximal tube and back into the bloodstream are saturated and at maximum transport capacity. If there is more glucose than can be reabsorbed, some of it will flow out into the urine and be excreted. However, under normal conditions, insulin would be there to keep glucose levels from ever getting too high in the glomerulus. Now for type 2 diabetes. This occurs when the body builds a resistance to insulin. While the beta cells are properly producing insulin and secreting it into the bloodstream, the cells themselves are refusing to recognize insulin, and thus blood sugar remains very high. The same symptoms of type 1 diabetes are present in type 2 diabetes. In type 2, if the condition persists for too long, it can result in a loss in beta cell insulin production. Treatments for both types may include insulin injections, strict diets, exercise, close monitoring of blood sugar levels, and oral sugar wafers in case the blood sugar drops too low after self-administering insulin.
Sugar, how you get so fly? Sugar, 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 sugar, how you get so